that today onwards we will discussing liver channel. हम लिवर चैनल की बात करेंगे, बड़े मजेदार बात होने वाली है, इसलिए एकदम अलर्ट रहिएगा। Liver channel starts from the great toe. We'll show you the route of the liver channel. This is starting of the liver channel, starting from the great toe. We can see the liver 1. Very, very important point. Liver 1. Right? This is the location of liver 1. Then this meridian moving upward. फिर ये meridian ऊपर की ओर जाता है. Then there is a location of the liver 2 point. Half chun, just a half chun. Proximal. बेमर्ज से आधा चुन ऊपर liver 2 होता है. Then liver 3 point is 2 chun away from the bay margin. 3 अंगुल से नाप सकते हैं. We can measure with the 3 finger. So this point is located from the bay margin. It's a 2 chun. This is the liver 3. Then the liver 4 is very important point found with the ankle joint. हमारे ankle joint में ये corner पर पाया जाता है. We can see the depression here. This is the location of liver 4. Just in the depression we can see here. Front of the medial malleolus. हमारे medial malleolus के आगे की ओर ये depression जो होता है इसमें पाया जाता है. This is liver 4. Liver 1 to liver 4 we have seen. So let's discuss first 4 point. Liver 1 to liver 4. You can do Google. You will find all the location. You can see any books. There are lots of books available on the meridian. And if you don't have any meridian, even I will give you PDF of some meridian books. Right? You can see them. Now, I also decided, because there many persons are not aware with the very, very fundamental and the basic concept of the TCM. So I will post one video every day of basic TCM. Basic. Very basic TCM. Very basic. Like we'll discuss what is source point, what is G cleft point, what is. So I will post in the group, final group. But for the 5 days, I will put in the general group. Prepare all the videos, like today, day 1 video, tomorrow, day 2 video, then day 3 video. After the 5 video, we'll discuss. This will go simultaneously. Some the participant advised me, and I felt this is the right way. Right? ये सही तरीका है. तो मैं एक वीडियो दूंगा 40 minutes का, जो बहुत ही बेसिक होगा. Sometime we'll discuss about the very basic things about the, and these videos are from the basic TCM course. Basic TCM. Okay. Because in this course, we want to go on little higher dimension. But we don't want this also that some people is not having any knowledge of the TCM, feeling difficulty. So we don't want that. हम वो भी नहीं चाहते कि किसी व्यक्ति को TCM नहीं आता तो वो कोई difficulty feel करे. So we'll work on both things, right? Okay. Is it good? Will you able to prepare one video? Good. Wonderful. So now, liver 1 to liver 4 point. Liver 1 to liver 4. I will tell you, liver 1 is the very important point where the liver meridian starts. अभी हमने लोकेशन देख ली ना? Okay. I will tell you about my father. My father used to do the treatment I used to see in my childhood. I have seen this treatment many times. What is the treatment? When the person is having multiple problems with the liver channels, like the problem of the eyes, red eyes, or sty near the eyes, inflammation in the eyes, he used to puncture the great toe and was taking out few drops of the blood. वो great toe को puncture करके उसमें से कुछ drop blood निकाल देते. He was not knowing that this is the liver meridian. No, he just know this as a traditionally, and the treatment was very successful. I will show you what he was doing. मैं ब्लड नहीं निकालूंगा, पॉइंट दिखा दूंगा, राइट। ब्लड निकालने के लिए कोई दूसरा बंदा, दूसरा बकरा चाहिए, उसका मैं ब्लड निकाल सकता हूँ, अपना खुद का नहीं, राइट। So let's see, look at here. You can see my feet here, right? It's visible. You can see my feet here, right? Okay. So we can see the great toe. And we can take the blood anywhere from this area, anywhere. Just prick this area, here, 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 anywhere. This entire great toe is coming under the thumb, under the liver channel category. So we are pricking here and taking out the few drops of blood. And this will balance entire liver meridian. अगर हमारे लिवर मेरिडियन में कहीं भी कोई गर्मी है, इससे निकल जाएगी. My father has treated at least more than 100 patients successfully with the success, right? So it is a very wonderful treatment. Liver 1. Liver 1 is called horary point of the liver channel. What is horary point? Definitely one video I will post as per my commitment with all of you. There is one video of the horary point also. I will tell you only in few seconds what is a horary point. Horary point is like an antenna. Antenna. And we know in the previous time, when we want to see some Doordarshan, some television, we used to put the antenna on the full upper like roof, right? Then we were rotating the antenna. Have you done that? आपने किया वो? ऐसे एंटीना घुमाते थे. आया क्या? हाँ आ गया फिर से ऐसे हो गया. हाँ अब आ गया ऐसे करके सेट करते थे. I have done. Right? So the horary point is like an antenna adjustment. Yes. Horary point is like an antenna. New generation is not doing is what is speaking about. What is doing like this? But the person who has seen the 1980, even 1990, maybe 95, I think 95 also, they have seen this. Adjustment of the antenna. Okay, then it will catch the particular frequency. In the same way, every meridian having one antenna. Liver meridian having one antenna, from it will receive the energies from this cosmos. That is called horary point. That antenna is in the liver 1. Okay, liver 1. Every meridian having that antenna. What is this antenna? You will get the complete idea in that video of the horary point. So I'm not like investing my more time here, right? For horary point. Okay. So as soon as we prick the great toe and taking out the few drops of the blood, it is balancing heat anywhere in the liver channel. कहीं भी liver channel में गर्मी बढ़ी हुई से balance कर देगा, right? Like someone is suffering with a multiple problem of the liver problems. I will tell you what are the problem or the liver. So quickly I will write here. So what are the problems? I will write only few problems. The list will increase day by day. ये लिस्ट बढ़ती जाएगी. मैं आपको कुछ प्रॉब्लम लिख के बता रहा हूं. So the problem due to liver imbalance. Problem due to liver imbalance. So the very common problem, number 1, or we can tell not the problem, symptoms. Symptoms of liver imbalance. Symptoms of liver. हम कैसे पहचानेंगे कि भाई इस बंदे का लिवर सटका हुआ है, इस बंदे का लिवर गड़बड़ा गया है? So the symptom of symptoms of due to liver imbalance. Number one, very important symptom, mood swings. Mood swing. Number two, even many person having liver imbalance, they also have bloating. Generally, bloating is the sign of spleen, but the liver person also having bloating. I will discuss what type of bloating. Number three, irritability. Irritability. Number four, PMS or premenstrual syndrome. Premenstrual syndrome. Number five, irregular period. Or painful period. So these are the signs, right? Symptoms. अब मूड स्विंग क्या होता है बताइए मूड स्विंग क्या होता है डू यू नो व्हाट इज मूड स्विंग विदाउट द लिवर you can't be the person of mood swing के लिए लिवर इम्बैलेंस होना बहुत जरूरी है मूड स्विंग यू अंडरस्टैंड व्हाट इज मूड स्विंग swing sometime this person was very jolly oh how are you please come again whenever you come here please meet me and sometimes you are going even he is not smiling not looking at you have seen the person like this देखे ऐसे लोग आप में से कोई ऐसा एनीवन फ्रॉम यू होंगे डॉक्टर तो बहुत मूड स्विंग्स होते हैं डॉक्टर को क्योंकि लिवर ची स्टैग्नेशन तो बहुत होता है डॉक्टर्स का नंबर टू bloating bloating means yeah bloating means bloating oh you have eaten this much but the abdomen become oh like a balloon बहुत खा लिया but you have not eaten too much so like the someone is filling the balloon so like tension like that is coming due to liver bloating oh I'm not doctor I'm not eating anything but still I feel too much fullness in my abdomen that is due to liver chi the how to recognize this bloating is because of the liver chi like if you filling the air in the balloon after some time there is a feeling now this balloon will be bursting out okay आपको लगेगा कि भाई बहुत हवा भर ली अब तो बैलून फट जाएगा तो वो जो फटने की फीलिंग होती है मीन्स वेरी वेरी डिस्टेंटेड फीलिंग इन द एब्डोमेन दैट इज ड्यू टू लिवर ची दैट इज ड्यू टू लिवर थर्ड irritability you know irritation we get irritation sometimes okay so irritability means one person told one person went to Ganga Snan you know Ganga Snan हरिद्वार में गंगा स्नान किया उसने और कहा हे गंगे from today onwards I am surrendering you my anger after today there is no anger I will never be angry he came back to the home then his servant asked Malik ji what you have done in the Ganga oh I have surrendered my anger I will never be angry now oh you are so great then after 30 minutes he came Malik ji what you have done near the Ganga I have surrendered my anger after 10 minutes some friends came and was sitting Guruji what you have done near the Ganga I told you I surrender my anger now after 1 hour he came Guruji before asking Guruji took the juta and running behind So that is anger. So anger means we can't surrender anger so easily, right? Anger को छोड़ने तो आसान नहीं है until and unless you do the treatment of liver chi. Am I right? So anger is irritability, irritation. Yeah, this person is irritating me again and again. Oh, my mother-in-law always irritate me, always. And mother-in-law is also telling, oh, this is also always irritating me. This is doing something to irritate me only. So that irritation because of the liver energies, right? So now PMS, you know PMS, premenstrual symptoms, premenstrual. Before the period, lots of mood swings, lots of pain, lots of mental ups and downs. That is premenstrual syndrome, right? PMS, you know that? PMS. Many females are having the PMS is also very common nowadays, and PMS is due to the liver chi disturbances. When the female is having some physical, emotional symptoms. पीरियड स्टार्ट होने के एक वीक पहले, कभी कभी तो 2 वीक पहले भी स्टार्ट हो जाते हैं दैट सिम्टम्स स्टार्ट्स 1 or 2 week before the periods. What are the symptoms? Now just period is going to start maybe after 3 days, maybe after 4 days she will start backache, acne, or craving for chocolates or some special food, right? Headache, joint pain, irritability, mood swings, sometimes crying, lots of anxiety, not able to focus. So in this way, these all are PMS, premenstrual syndrome. Is it clear? There might be many other. This is also due to the liver disturbances. Irregular period. Maybe period is coming after 15 days, every 15 days, or maybe not coming for 2 months. That is due to liver. And painful period. Painful period, lots of pain during the period. Yeah, heavy breast also. That is a sign of PMS, right? Perfect. Even no sexual interest. That is also sign of PMS. Okay. So now we find out, okay, this person is having symptom of the liver. Because the first question comes, how to find out the person? ये symptom तो होना जरूरी है. Without this symptom, how can we find out that we have to treat the liver or we have to treat something else? Okay. So before discussing more point of the liver, first I would like to tell you few things. When the person is having these symptoms, like mood swings, like bloating, like irritability, like PMS or the premenstrual syndrome, like irregular period, or like the painful period, what is the meaning of that? The meaning of that is, yeah, depression also before the period. Yes, you are right. कि बंदर को किसी ने रस्सी से बांध के, एक जंगल के बंदर, पालतू बंदर को नहीं, the monkey of the forest has been tied with the rope. What will do? He always want to run here and there, right? Monkey. So liver chi is not able to spread. This is the problem. What is the treatment? Treatment is spread liver chi. Done. क्या ट्रीटमेंट करना है? लिवर ची को स्प्रेड करना है. Why the problem is happening? Liver chi is not able to spread. So write on the sentence. Very, very important sentence. Yeah, wonderful. We have to do. Right now we will not take. Yeah. हम अभी ये either the chi is high or no, chi is low or no. We are not thinking in that way. Everything is balanced, but the things should spread, but not able to spread. अब बताइए, आप एक चीज बताइए. You are cooking something in the pressure cooker, right? Pressure cooker. Now fire is continuing, but your whistle is not working. That is not working. Whistle is not working. What will happen? There might be cooker might burst or not. अगर कुकर में लगातार फ्लेम चल आ रही है और उसकी वो काम नहीं कर रही है सीटी, it might explode. The same thing, liver cheese want to spread. Very, 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 very disturbed. So the disturbance will express in the form of PMS, premenstrual syndrome, painful period, irregular period, irritability, mood swings. So what is the treatment? Open the cooker. Okay. Remove the gas. Open the cooker. Let it spread all around. That is the treatment. So now, yes. Yeah. So this is the treatment. So let's write down here. So why these problems happening? These problems are happening because we will tell why these problems happening. Because liver chi is not able to spray. Oh, what is the treatment? What is treatment? Okay. Allow liver chi to spread. लिवर ची को फैलने दो, यही ट्रीटमेंट है. सो हाउ और व्हाट आर द पॉइंट्स? व्हाट आर द पॉइंट्स? इसके क्या पॉइंट्स होंगे? सो द फ्यू थिंग्स. नंबर वन, now remember few things, few points. The liver 3 and Li4, there are two very wonderful points. Liver 3 and Li4, they are spreading liver chi. ये दोनों लिवर ची को स्प्रेड करते हैं. So liver chi is not spreading. Sometimes due to emotional problems and sometimes due to फिजिकल ट्रॉमा. फिजिकल ट्रॉमा, चोट लग गई, एक्सीडेंट हो गया, फिजिकल चोट लग गई, इंजरी हो गई और आपकी लिवर ची स्प्रेड नहीं कर पा रही. लिवर ची इज नॉट एबल टू स्प्रेड. और मे बी इमोशनल सप्रेशन, राइट? सो नाउ whether the physical trauma or the emotional problems which is not allowing, so which is causing the liver chi is not spreading. How to spread the liver chi via the liver 3 and Li4? So this is called liver 3 bilateral, Li4 bilateral. This formula is called the formula of 4 gates. So now we are having 4 gates in our home. This is the home. We are having gate number 1, gate number 2, gate number 3 and the gate number 4. From there energy will spread, chi will spread, ऊर्जा स्प्रेड करेगी. तो इस फॉर्मूले का प्रयोग हम कहां कर सकते हैं? इस फॉर्मूले को हम लगा सकते हैं यहां. ब्लोटिंग, मूड स्विंग्स, इरिटेबिलिटी, प्रीमेंस्ट्रुअल सिंड्रोम, irregular period and the painful period. Now, so this formula is called the formula of 4 gate. Now suppose the person was going from the scooty and got accident. So the body pain, this is called physical trauma. इसे कहते हैं हम physical trauma. So we will put Li4 bilateral, liver 3 bilateral and pain will go away. Sedate all, सबको sedate कर दिया, right? So just we have seen here the liver 3 point located here. ये हमारा लिवर 3 पॉइंट है, ये हमारा लिवर 3 पॉइंट है, यहां पर आपको लगाना है. And also we know the location of Li4. Li4 is very famous point. I think everyone is knowing that. हमें एक पॉइंट यहां लगा देना Li4. Now whether we put the magnet or the needle, whether we put in the body or in the sujog, we will treat the patient successfully. हम patient को successfully treat कर सकेंगे. This is the location of Li4. Now, one patient is coming to you. One patient is coming to you, doctor. Whenever I am, doctor, whenever I am emotionally disturbed, whenever I am emotionally disturbed, okay, or I get anger, or whenever I am irritated, my chest muscle start paining. Chest muscle start paining. Okay, try to understand. Heart is made by muscle. Heart is made by cardiac muscle. Am I right or not? There are three types of the muscle in the human body. One is skeletal muscle. This arm muscle, leg muscle, who move your bones. पहली तो वो मसल है जो हड्डियों को मूव करती है. Second, cardiac muscle. Heart is pumping all the time. Cardiac muscle. If it is made by muscle, then only can pump the blood. Third is smooth muscle in the digestive tract, intestine. So we have three types of muscle in the body. Now, if the person is telling you, doctor, whenever I am having some irritation, I feel muscle pain, I feel chest. Maybe some person will tell you, okay, whenever I am stressful, I feel neck pain. Okay, remember one thing. Whenever the muscle and tendons are involved, again we will tell liver chi. But if this person is irritated, having mood swings, yes, irritated, angry, yes, liver chi stagnation is there. You want to work on the muscle, then use the gallbladder 34. Gallbladder 34 is the point who will spread the liver chi in the muscle and tendon. I will repeat. अगर किसी व्यक्ति को अगर किसी व्यक्ति के मसल और टेंडन में दर्द हो रहा है किसी ट्रॉमा के कारण, मे बी इमोशनल ट्रॉमा, मे बी फिजिकल ट्रॉमा, if there is a pain after the physical or emotional trauma in the muscles, then again we have to spread the liver chi in the muscles and tendons. Point will be gallbladder 34. So I will write down here so you will be able to understand. Okay. So after physical injury or the trauma, or emotional trauma, or after anger, after irritability, if someone is having muscles pain anywhere or the tendon pain anywhere, so we will stimulate the gallbladder 34 Gallbladder 34 will spread the liver chi in muscle and tendon. Okay. One female is telling you, doctor, when I am having period, before the period, I have lower back pain. Lower back pain. Okay, so how to work on the lower back pain? Gallbladder 34 will treat the muscle of lower back. Muscle of lower back. So remember here, gallbladder 34, as per the acupuncture, after the injury or the trauma, if our energy is flowing, energy is not stuck, then we will not feel the pain. I will repeat my sentence. हमारे शरीर के 100 टुकड़े हो जाए, 100 टुकड़े, लेकिन ऊर्जा का फ्लो बना रहे, कैसे भी बना रहे, दर्द नहीं होगा. There will not be pain. If the energy is flowing, why the pain is there? Because energy gets stuck. Even we are not getting fracture, sometimes we feel the pain. We are not getting any injury, sometimes we are feeling the pain. Suddenly we are getting lower back pain or the knee pain, but if we do the X-ray, MRI, everything is normal. So pain is there not because of the bone is breaking or there is a muscle or tendon tear. Pain is there because of blocked chi. अब आपके पास एक पेशेंट आया, डॉक्टर, आई हैव स्लिप डिस्क. Okay, disc is going this side. Okay. Oh, and MRI also written slip disc. Okay. Now we are doing the treatment. After the treatment, patient is telling, I'm feeling better. तो क्या एक सिटिंग में डिस्क अंदर चलेगी? No. Disc will not go in one sitting, but patient start feeling better. Why? If disc is not in, then why the patient start feeling better? Because you are making the flow of energies from that part. Immediately patient will start feeling good, and after some time, maybe next day, maybe after 2 days, pain will come back because again energy gets stuck. So we have to do the certain number of the treatment to bring the patient at the 100% normal condition. तो हमने देखा कि अगर मसल टेंडन्स में कहीं भी कोई ब्लॉकेज हो गया है, गॉल ब्लैडर 34 से रिमूव कर सकते. अल्टीमेटली वी हैव टू remove the blockage and bring the normal flow of chi. Now, suppose sometime we are getting the problem, we can divide the body into 3 parts. हम शरीर को 3 भाग में बांट सकते हैं. Upper body, which include chest, even the head region. Middle body, which include this stomach, digestive part, and the lower body, which include genital part, urinary bladder, prostate, uterus, and all. We can divide the whole body in 3 parts. हम संपूर्ण शरीर को 3 भागों में बांट सकते हैं, right? Some person might feel the pain in this part. This is the middle part of the body. Some person might feel the pain in the upper part of the body here. Maybe in the chest, maybe in the head region, maybe the migraine headache, that is the upper part. You are getting angry and suddenly start headache. Anger के बाद सिर दर्द start हो गया. Or maybe without the anger also, if you are feeling the headache, something happening in the upper body, So now why the pain in the head? Because liver chi is not flowing properly in the head. Why the pain in the middle body? Because liver chi is not flowing properly in the middle body. So the nature of the liver chi, it always want to be in the flow and always promote other meridian also, please be in the flow. It will go to the lungs and will tell lung, okay, keep on flowing. It will go to the intestine, small intestine, large intestine. So liver chi will go everywhere and will promote every channel for free flow. ओके तो लिवर chi खुद भी स्वतंत्र है और हर मेरिडियन में जाकर ये उसे मैसेज देती है कि आप भी खूब फ्लो करते रहिए, just keep on flowing every meridian. So now when a person is having some problem in the middle part of the body, maybe in the stomach, maybe in the some like part of the gallbladder, or maybe digestive issues and all. So liver 13 is the point who will make the free flow of the energies and remove all pain from this part. Liver 13, right? And liver 14 is the point who will make the free flow from this as well as this part. So now we can understand the very, very important role of the liver 13 and the liver 14. हमारे पूरे इस भाग में लिवर 13 ऊर्जा का फ्लो चालू कर देगा और लिवर 14 अपर एंड मिडिल पार्ट में ऊर्जा का फ्लो चालू कर देगा. So we can see step by step the multiple liver point having the different actions, very beautiful actions. Ultimately, the liver is born for free flow. Okay, now liver 13 कहाँ होता है? लिवर 13 को ढूंढना बड़ा आसान है बिकॉज लिवर 13 इज एट द लेवल ऑफ नेवल, हमारे नाभि के लेवल पर ही होता है. इफ यू सी द अपर लेवल ऑफ द नेवल, आपके नाभि के ऊपर के लेवल से जस्ट गो नियर अबाउट 10 फिंगर लेटरल, 4 4 and 2. Upper level of the navel, 4 4 and maybe little more, 4 4 and I will tell you how to look at the liver 13. Liver 13. It's very simple. Now you'll see me. So we will bend the elbow where the elbow touching the body. Where elbow touching the body here. Here we have 11th number rib, the tip of the 11th rib. This is near about, if the navel is here, the navel is here. So if we go at the level of navel, it's near about 2 finger up, right? So the tip of the 11th rib is the liver 13. We can measure in that way, bending the elbow. Elbow को bend करें तो जहां पर ये पहुंचती है वहीं पर liver 13 आपको ढूंढना होगा. That is found at the tip of 11th rib. I will show you in this image. And how to stimulate very, very smoothly, very properly, very gently. Even I will explain you. So in this image, you can see here. So this point located near about the level of navel, but also many person having little bigger abdomen, then we have to think. So we can see this is the liver 13 point. We can see at the upper level of the navel, liver 13 point. And we can see this is called anterior axillary line. So this is the liver 13. Okay, now I will tell you the other way to look at this point. इसको locate करने का एक दूसरा तरीका. Let's see here. So liver 13 is very much important point, and we can also measure in this way. So suppose this is the human body here. So we know this is the axilla. ये axilla है, ये अंदर axilla है, right? So if we draw the one line in the anterior part of the axilla, one point of the middle part of the axilla, maybe I have to use other image for clear understanding. Give me 1 minute. So you can see this image. So this is the axilla. One line we are drawing in the center of axilla, one in the front part of the axilla, but the back part of the axilla. So this is called mid-axillary line. This is called anterior axillary line. And this is called posterior axillary line. तो हमने 3 लाइन देखी. जो एंटीरियर एक्सिलरी लाइन की लाइन में हमें लिवर 13 मिलेगा. Now it's become very easy to locate the liver 13. So now what I have to do? We have to go at the upper level of the navel region. हमें ये नाभि है. From the upper level of the navel, we have to go this side, and like this. Here we'll found the 11th rib, the tip of 11th rib. हमारी जो 11वें नंबर की पसली का टिप मिलेगा. दैट इज द लोकेशन ऑफ लिवर 13. यही हमारे लिवर 13 की लोकेशन है. सो लेट्स सी हियर. So we can see here. So this is the 11th number rib, this one. So we are searching the tip of this 11th number rib. So liver 13 point located here. Liver 13 का पॉइंट है, इसके ऊपर ही लोकेटेड है. ये जो हमारी 11वीं रिब है, this one. So here the liver 13 point located. So we are trying to palpate this area. Now regarding the, so liver 13 is the point who is spreading the liver in the middle GIO. किसी ने कहा यार पेट बहुत फूला फूला लग रहा है, feeling too much tightness in the abdomen. Okay, it means there is a problem of the middle GIO. So we can use liver 13. Now what person is telling, oh, I am feeling heaviness in my chest, then liver 14. Because liver 14 is the point who is very good point for middle GIO, middle body and the upper body. Upper body. Is it clear? Now liver 14 is also very easy to locate. इसको locate करना भी, हम if we talk about the human body, this nipple is located below the 4th number rib. हमारे 4थे नंबर की पसली के नीचे निपल होती है. Then upper is the 4th rib, lower is the 5th rib, right? This is the 5th rib. We can palpate the rib here. Okay. Then we can find the 6th rib. 6th rib is here. Below the 6th rib, that is the liver 14 in the nipple line. Nipple line में ही 6वीं रिब के नीचे liver 14 होता है. Another way to find out, I will tell you how to find out in the females. Okay. So this is the navel. We can see this is the navel. And this is the bone, sternum bone. This is the lower part of the sternum. Okay. This length is divided in 2 parts. So we are dividing this length in 2 parts. This is the middle part. Okay. Half is upper, half is lower. Again, this length divided in 2 parts. Again, we can divide this length in 2 parts. So half is upper and half is lower. This is the CV 14 point. I will repeat again. From the navel, if I go 6 chun up, 1 chun, 2 chun, 3 chun, 4 chun, 5 chun and 6 chun, I will reach on the CB14. हम CB14 पर पहुंच जाएंगे. CB14 point is 6 chun up from the navel region. At the level of CB14, in the nipple line we have liver 14. यहीं पर हमारा liver 14 है. CB14, liver 14. We can feel the ribs and below the ribs. So CB14, तो CB14 को ढूंढ लो, या तो rib को ढूंढ लो या CB14 को ढूंढ लो. Now we have to search this point. As soon as we are able to search this point, we have to massage this point because needle we are not putting here. We have to massage this point. हमें इस point को massage करना. So now liver 14 is the point who is bringing the normal health in the upper and middle GI. So now someone is suffering with a premenstrual syndrome. What will be the protocol? Mix all the points. What are all the points? Li4, liver 3, then gallbladder 34, liver 13 and the liver 14. All the points. We are mixing all the points, right? So let's see, I am mixing all the points here. Li4, liver 3, liver 13, liver 14 and gallbladder 34. Gallbladder 34 muscle and tendon. Liver 14 for upper GIO and middle GIO, means upper body and middle body. Liver 13 for middle GIO, and liver 3 and Li4 will spread chi of liver everywhere. And liver 13 will spread the liver chi in middle GIO. Liver 14 will spread the liver chi in middle and upper GIO. Gallbladder 34 will spread the chi. These all points are spreading liver chi. In the next class, I will discuss two more points. One is the pericardium 6 and one is the urinary bladder 18. Then this protocol will be complete. इस दो पॉइंट का डिस्कशन हम अगली क्लास में करेंगे, तभी हमारा पूरा प्रोटोकॉल कंप्लीट हो जाएगा. We have to sedate all the point. So now the person is having irritability, mood swings, premenstrual syndrome, irregular periods, painful periods, will apply this formula, will spread chi. Or the person is having body pain anywhere, will apply this formula and spread the chi. Is it clear now? Are you able to understand? TCM is not the thing कि वो हमें रट के एग्जाम पास थोड़ी करना है. We have to understand the concept. Okay, so that's why we need to understand everything. Okay, so thank you so much everyone. Now this video will be published tomorrow if anyone want to revise. So now we'll see you on Monday. अब हम Monday को मिलेंगे. So today is the day 2. Then Monday will be day 3. Then Tuesday day 4. Wednesday day 5. So till the day 5, this class will be open for all. Now from the Thursday onwards, this class only for the enrolled participants. And video of all the 5 days will be published for all of you. You can see that. Okay. Thank you so much everyone. See you on Monday now. Closing the session.